So, as the medical profession has developed the treatment plan for oral cancer, we talked about clinical trials, we talk about other options, medications that you could take. I would definitely now, post treatment, be willing to reevaluate all those things. I think that's really important because I also know that there are post treatment side effects that potentially linger. And so, if there are drugs and medications that can help that, I'm all for it.
I wasn't really presented with treatment options on trial. Again, the type of tumor that I had is rare enough that there wasn't really a trial. Certainly, I could have been thrown into just a trial that might have taken all comers, but you kind of do that at a later stage of treatment.
So I think I'm the oddball. I'm always the outlier on these things. I would think most people, their doctor would select their clinical trial because I can almost guarantee you 90% of the people you talk to have never heard of a clinical trial. At the 2-year mark, the oncologist said, you have cancer. Again, it's metastasized to your lung. And you've had enough radiation for a lifetime. We need to do something different. He said, you and your wife have always asked a lot of questions. So I'm going to ask you to search the database and find a clinical trial for yourself. So I got on the NCI website, which is the National Cancer Institute, and they have the database there that you can search. You have to know your diagnosis. You have to know your type of tumor. You have to know the location of your tumor. You have to know, there's all these different things you should know. So I was able to come up with 7 or 9 different trials that I thought might be for me. And printed them out, handed them to my doctor. A couple days later, I get a call about 9:30 at night. And he says, I've gone through these, and it was a bit like Goldilocks and the bears, 3 bears. It was like, this one's not good for you, and this one's, no, this one we might try. And he says, you are asymptomatic, you're healthy, and you're young, and we caught this early. They are going to want you in this trial. I went, oh, that's encouraging. So there were 2 hospitals within an hour and a half drive of me. We went down there, went through all the pre-testing and all that. Of course, I had to get a biopsy again. The doctor we ended up with, her tenacity is what helped save my life. When you sign up, they draw your blood, and you sign the paperwork. And then there's a window that they have to start treatment. It's part of the protocol. It was Monday at 6:30. And she says, Jeff, I just got off the phone with the Los Angeles lab. You've been approved. Can you be here tomorrow at 7:30 in the morning to start treatment? And long and short of it, that was the last day of the trial. I'm the last person to get in it. And I'm still here. I'm still here because that particular clinical trial, I had 100% response from that drug, and that saved my life. I was very fortunate. I had 100% response to the drug that I took, and it's now been approved for different cancers. I couldn't have said that 4 years ago. 7 years ago. Wow, 7 years ago. So it's keep asking questions, never accept unreasonable answers, and stay positive. You're going to get through it.